Welcome back to PPCM's Painful Truth. Today's guest, Elma Griffiths.
Thank you so much for your time today in educating us on your peripartum cardiomyopathy PPCM experience. How old were you the first time you were diagnosed?
I was 30.
You were 30 years old. Were you diagnosed during your pregnancy? At what point were you actually diagnosed, and how?
I was during pregnancy, I was like 30 weeks or 32 weeks, something like that. And I went to the emergency room because I couldn't breathe. And so they did an x-ray, and then they saw that my heart was enlarged, and they did emergency C-section.
So they diagnosed you once your life was already at a threat.
Yeah.
Not prior.
Yeah.
And when they diagnosed you, did they say what they did to diagnose you? Was it the NT-proBNP test?
No, I just woke up. I just remember waking up in the ICU, and then the doctors came in and just told me that what I had. They just said, well, you have postpartum cardiomyopathy, and it's really rare, and it just happens during pregnancy.
Yeah, that's interesting because a lot of the medical community say it's rare, but if it's not diagnosed, then how can they say that? If they're not, and to be honest, the mandatory screenings, tests, and labs that should be raised for the standard of what's currently right now, they can't make really comments that it's rare, because really it's just rare for anyone to have awareness, which is why, it's important for us women to discuss these conversations and having these conversations that, I experienced what you experienced, which was very common. Excuse me, heart failure, not COVID.
Yeah.
I always say that because I still have a tickle. When a woman survives a maternal mortality, it's almost as if we feel like we need justice. And did you go back to your gynecologist to say, I was diagnosed as peripartum cardiomyopathy, and what did your birthing professional, how did your birthing professional respond to that?
Well, what happened was, because for a while I was having a cough, and I was having a hard time showering and walking, and I was telling him all this, and he just said I had allergies, and he gave me allergy medicine and coughing pearls. And then my last visit,
did he test you for allergies, or did he just have the intuition that that's what was going on with you?
No, he didn't test me. He just thought that's what it was.
Okay.
And then my last visit with him, I was really not feeling good. I was really having a hard time breathing. And then he said he was going to do an x-ray. And then he came back saying, I don't think I need to do an x-ray. And so he's like, if you feel worse, just go to the emergency room. I was like, okay. And then 3 days later, I went to the emergency room.
And then the emergency room diagnosed you?
Yeah.
And that's great. What hospital?
It was University of Utah Hospital.
Okay. And is this your first pregnancy? Was this your first pregnancy?
No, it was my 6th.
Your 6th pregnancy?
Yeah. Mm-hmm.
Did you feel that maybe you had it before and didn't know it because you were not diagnosed, but this maybe been a relapse, or did you feel different? How did you feel different with this pregnancy as opposed to the different 6 pregnancies that you experienced? What was different about this one?
Yeah, it was different. I don't think I had it with my other ones. I didn't have the symptoms like I did with this one.
Okay.
And I just felt really horrible. And I kept telling my doctor there was something wrong. And he just pushed it aside. And then when I was in the hospital, he came and saw me and he apologized.
That's kind. I respect that. I
Hmm.
respect that, like, with my whole heart, when a doctor, says, I didn't know, but now I know. And
Yeah.
hopefully now in his practice moving forward, now he can put the pieces together and, help and save another woman from possibly a preventable catastrophe from this awful disease. How has this pregnancy affected you after, um, due to the diagnosis? Did the symptoms go away? I know with me, after a C-section, um, was when I started to peak. Everything started to exasperate, the swelling, the symptoms. How are you after your C-section?
I was not getting better. My EF was 10, and
So is mine.
they put a pacemaker in, and
Yeah,
then that didn't help. Wasn't doing anything, and put me
right.
on meds, and it still wasn't doing anything. And I was
Yeah,
like
they put a
always in
they
and
put a
out of the
defibrillator.
hospital.
They put a
Huh?
defibrillator. They put a defibrillator inside of me,
Hmm.
and it didn't do anything except for cause so many complications. So yeah, when was your pacemaker implanted?
It
At the
was
hospital at
like
the time?
it was 4 months after I was diagnosed, and they tried medication, and then that wasn't working. Then they put in the pacemaker defibrillator, and that didn't work. So they put me on the heart transplant list, and then they said they were doing a study with the LVAD where they put an LVAD in and see if it heals your heart, gives your
Hmm.
heart a rest. And then so I did that, and I had the LVAD for a year, and my heart actually recovered with the LVAD.
And
And
what is your EF percent today?
it's 50. They said it's 59.
Wonderful. So you pretty much somewhat made a full recovery out of PPCM and survived the maternal mortality death.
Yeah.
Um, I mean, after, um, you know, this 4 months after having the implant, did they say this is not working and we're going to remove it, or do you still currently have it implanted?
I still have it.
You
They
still
said
have it
I'll always
implanted.
have it.
Okay. And I mean, this is an interesting conversation because I had a defibrillator. Um, do you have complications like scar tissue? Do you have any complications with your device, or is it it's just in there and you can feel it? Like, how is the device, um, how are you coping with that?
It's okay. I don't really notice it that much. Um, except for it has a big bulge right there. It's kind of annoying.
Yeah. Yeah.
But yeah. And then like it shocked me a few times, and so now I'm like kind of worried about that. Like when I
Yeah, being
exercise and
shocked.
stuff. Yeah.
And so, how long has it been since you've had this defibrillator?
It's been 7 years.
7 years. So you're going to have to probably eventually replace the wires,
Yeah,
correct? Like
eventually.
this
I
eventually.
just recently replaced the battery thing, but the
Yes.
wires, I still have the same wires.
Yes. Well, your six babies need their mommy.
Yeah.
and they're so adorable. I see them on Facebook. They're beautiful. Um,
Thank you.
I as opposed to, I guess, the support group during, you know, being diagnosed after the C-section, just having an infant, you got 5 other children. Who was able to maybe help you during your challenge of recovery?
We had people from church, and then I had my sister, my older sister. She helped a lot, and my husband helped as much as he could. He worked a lot, so
yeah, it's a challenge to
yeah.
balance and kind of get back into so-called normal status when your health is, challenged physically. But also, mentally, did you experience like any type of depression, postpartum depression with this pregnancy?
Yeah, it was pretty bad. Like I think, struggle from it.
Yeah. I think we will
It-
always have endless, it's the coping in the
mhm.
moment.
Yeah, I don't think it's ever gonna go away.
No, yeah. It's just a matter of coping. And what do you
Mhm.
do to cope with that when you are feeling like overwhelmed, with the dramatic event?
Usually I just go in my room and take a nap. Just have
I
some alone time.
yeah, I do the same. I like to sleep, listen to like, piano. I
Hmm.
like to have piano in my ears when I do the dishes or the laundry or something to just distract the mind. Sleeping
Yeah.
really does, help. Um, heals the mind. So I feel like with, having the experience of being a mom with, 5 other children, how old is your oldest?
How old is my oldest?
Mhm.
She's 20.
Okay, so within 20 years you've been a mom,
Hmm.
and so you know um I only have one son. I had PPCM, and that was it. I can't have anymore. um you know and can compare from 20 years ago to this pregnancy. What would you say is like the biggest learning experience? Because obviously, with having multiple pregnancies, have you ever heard of this disease before? Being pregnant so many times, like, is this your first awareness as well
Yeah,
of the
I've
of the
never heard anything about that. Like, I didn't know anything about it at all. I think if
right?
it would have happened like 20 years ago, I probably would have died.
Absolutely. I same.
Yeah.
So yes, we are very, very lucky to be here, and every survivor is is a miracle, because we could have easily have, stayed on the other side. Our voices, today and always, just don't speak on behalf of our personal experience, but for the women that are literally, over on the other side, that were once very healthy prior to pregnancy, are, you know, kicking and screaming over there like, what the heck happened? And
Hmm.
they don't have a voice. And us speaking up is basically, giving women, all women, um, the awareness to advocate on the preventions for when you're pregnant, that if something doesn't feel right, it's because it's not right.
Hmm.
Um, and obviously you have comparison, so you knew that something wasn't correct because you have you knew prior, this doesn't feel right.
Hmm.
And so it's interesting that, it takes a simple blood test like the NT-proBNP test to diagnose a woman, where a doctor shouldn't have to make an assumption, where it should be actually diagnosed and known, which is when they say that there's over 2,000 cases each year, how do they know that? If they don't diagnose with the BNP test, you can't make an assumption as well as the statistics, because 1 out of 4 women do experience this. So it is very common. It's not rare. It's just rare for any awareness. And so this hopefully will change with, you know, with women showing up and saying, like you, I survived maternal mortality and there's a prevention.
Yeah.
And what would you like maybe viewers to know about like your experience that maybe can help another?
I don't know. I just think if you feel like something's wrong, you need to stand up and put your foot down and just keep bugging your doctor. Don't let it go. Because I was telling him I was wrong and stuff, but he just wasn't listening. And I just said, okay. And then went along with it, whatever he was saying. Because I'm like, he's a doctor. He should know. But
Exactly. And that is a common statement that you just said with a lot of women that are being interviewed, that they just were not listened to. Doctors brush it off as whatever assumption that they have, but they really don't know because they haven't taken the only diagnosis test that should be mandatory and standard. There's actually a few of them out there. They're not available in the United States of America. They are available other places out of the country, which is why I believe we are one of the richest countries in the world, but have the highest death rate of maternal mortality, only due to the lack of awareness, as well as getting provided the proper education and training in the medical community with, you know, it's that what Dr. Fett says, and I mentioned it, it's the FSLT1. And the SFL is basically your cardiotoxic fluid, and the -1 stands for genetic, if it's genetic, and then the placental growth factor, which is the PIGF. When you combine the cardiotoxic with how the placenta is growing, you can determine, would also determine part of that is in cardiology, which is the NT-proBNP test. But women never think to go to their cardiologist when they're pregnant.
Yeah.
So that's where cardiology and gynecology have kind of failed women since the beginning of time by not collaborating this sooner than 2022, as of now that we are speaking up about this. And this is why I started my nonprofit as well as this platform, to give you a voice so you are heard, listened to, and maybe receive some sort of justice. Not that it can, like, you know, help your situation, but maybe save another young woman from this disease. And I think that, you know, how do you feel about, like, in, you know, in like 5 years, like, do you feel like, what are your doctors saying that you will have your follow-ups and stuff like every year, and you have to have your follow-ups, correct?
Yeah, I do it every year. I do a stress test and an echo and that right heart cath.
And your insurance company, do they, your health insurance provider, is that through your husband, or do you have your own insurance provider?
It's through my husband.
And do they cover a lot of the expenses for, I know that an EKG is like $2,000. You can walk out in an hour and have over $6,000 in medical bills with like a copay. What are normally like your copays for these type of screenings and follow-ups?
I'm not sure. My husband deals with that, but I know, because I was in a study. So, like when I do the echo once a year and the right heart cath, that's covered because that's part of the study. Like I'm in a 10-year study.
Wonderful. What is the study called?
I don't know what it's called.
It,
It's
what
through
kind of what kind of study is it, or who's it
it's
through?
it's through my heart valve team. It's to see about if the LVAD will heal the heart instead of having to get a heart transplant. So patients won't have to get a heart transplant. And
Got it.
so
And this is at which hospital?
University of Utah.
Okay, so it's the same place where you delivered your baby.
Yeah. And it's Dr. Dracos is the head guy, the head doctor.
That has taken you on as a long-term patient.
Yeah.
Wonderful. Well, you definitely have, a good support group with your husband and the insurance, because that's really the foundation of what, a survivor, if they can't, they have to outsource, how do they get covered and pay? And so, you have many blessings and, and continue hopefully many blessings to you and your beautiful family. And hopefully, this will not only just get out there and save lives, but, you know, can educate not just the medical community, but the actual individual woman that is currently suffering and doesn't know what's wrong, and saying, my doctor's saying I'm this, but I really feel that and I'm not getting better. Kind of like your story, where instead of doctors making assumptions, there needs to be awareness of this fluid disease, basically, that's crushing our hearts and suffocating us. And so, no, I thank you very much for your time today. And is there anything else that you would like to share with your experience, or anything else that you think that could, make a difference from your experience in saving somebody else?
Um, well, I ended up having a post baby, so it is possible.
It is
uh,
possible.
yeah. So then it was really a shock because I was on the depot shot. I had the depot shot. And it was 6 months after I had the LVAD taken out.
So you had
So
another baby after
yeah.
your PPCM? Oh,
Mm-hmm.
wow. So you have 7.
That's 7 total. Yeah.
You have 7 children total.
Yeah.
God bless you. Oh my
Yeah.
goodness. Wow.
No, and it
That's
ended up
amazing.
really good. I didn't relapse or anything. So
That's amazing. That's beautiful. Well, I, knowing that, you still were able to have a baby after with a defibrillator inside of you, right?
yeah.
Wow. That is amazing. Well, and your heart stayed throughout that pregnancy at a good percentage, or did the EF drop?
It stayed at a good percentage. It dropped just a little bit, like to 50. So they delivered him a little early. And then, but after that, I was fine. It went right back up.
So that really does indicate that every pregnancy really is different, because 1 out of your 7 pregnancies, you only had PPCM,
Yeah.
to your awareness.
Mm-hmm.
Wow. That's amazing.
Yeah. It was quite a shock. And my doctors wanted me to terminate the pregnancy because they said I wouldn't survive. But I couldn't do it because I knew I wouldn't be able to live with myself and I would regret it. So I went along with it.
Right.
And it's
And
good I
then,
did because now I have a cute little 4-year-old.
oh, and is it a boy or a girl?
Yeah, it's a boy.
It's a boy. You have all boys?
I have 2 girls and 4 or 5 boys. And
Well,
my 2 girls are the oldest.
Well, you are definitely a remarkable woman. I couldn't do it once barely. So all the props and respect to you and your, your baby making body.
Yeah.
Unbelievable. But I think that this has really been an insightful meeting because, it's interesting that you never know which pregnancy can have a pregnancy induced complication, whereas it didn't always happen. So every pregnancy is different. And I think there should be like a study on why, what made this pregnancy different than your other 6 pregnancies.
Yeah.
Is it because, and you had boys, so there has to be some sort of chemical blood sort of reaction. And I hope that someday, the IPAC research lab, Dr. Dennis McNamara or Dr. James Fett or somebody can do a study about this, because I think that's interesting. If we find the root of maybe the growth factor of the placenta and how what was different, was different in the placenta, the PPCM pregnancy as opposed to the other ones.
Yeah, that would be nice to know.
Yeah, I think so too. I'm very curious now. I'll have to ask.
Yeah.
And I'll let you know if I find out
Okay.
that answer, because it really is putting the pieces together with this disease. And, it's not always the mother, but it's the baby that can cause, this. It's a combination probably, but we don't know. And it's 2022. We should know this by now. Women been giving birth forever. And women have been dying after giving birth since you watch any, I love the royal TV series on Netflix and everything. You have the Spanish princess, the white princess. You have all the movies, even the Medici family, and every historical woman, queen, except for Queen Victoria, because she had 9 kids. You're like Queen Victoria. But every queen prior, even King Henry VIII, his first wife, she died after giving birth, and they called it childbirth fever. And that's what I've noticed, that the royal people, when a woman died after giving childbirth, they called it childbirth fever. But in 2022, it's called peripartum cardiomyopathy, PPCM. So we now have a name for it. And hopefully now that, there's this awareness that, women don't have to keep dying like it's the 1400s. So, well, thank you for, again, your time. I know it's, time is so precious, and you chose to spend it with me. So I appreciate that. And, and I look forward to seeing your journey throughout the years of staying healthy and persevering through the challenges and the mental health of, just living with, the fears and the scare and all of that. So I wish you nothing but the best, and hopefully, you live to you could see your grandbabies.
Yeah, hopefully.
All of them.
Yeah, same with you.
Thank you. I know. I appreciate that. And thank you so much. And it was lovely seeing your face. And I really appreciate you for sharing your experience with me.
Yeah. Well, thanks for having me.
Thank you. I'll talk to you soon.
Okay.
Thanks. Bye-bye.
Thank you for joining us and listening to the PPCM Fund podcast. If you haven't already, please like and subscribe. PPCM's Painful Truth is made possible through the generous support of donors like you. Help us spread the awareness by donating at ppcmfund.com. or click the link below to become a member through Ko-fi. Also, remember to join us every Monday and Friday for Mom Day Fitness. Have a great day.